Awareness Week, which runs from April 22nd to the 28th. This week encourages Canadians to have important conversations with their friends and loved ones about their decision to donate, to ensure that each of our organ donation wishes and decisions are understood. Today is also the official launch of our province's public awareness campaign about organ and tissue donation. So I'd like to start today's event by extending a warm welcome to the organ donors, transplant recipients and their families who are joining us today, and well wishes to those who were not able to attend. Thank you for your continued support and commitment in helping us raise awareness about the importance of organ and tissue donation. You keep all of us focused and why we are here. I'd also like to thank the hundreds of Saskatchewan Health Authority staff and physicians who provide care to donors and recipients every single day. Thank you for your dedication in making sure that donors and transplant recipients receive the best possible care. I'd like to also thank our partners who make organ and tissue donation a priority, including the Government of Saskatchewan, the Saskatchewan Health Authority, the Saskatchewan Transplant Program, and the City of Saskatoon. At its meeting on Monday, April 30th, City Council will formally proclaim the week of April 22nd to 28th, 2018 as National Organ and Tissue Donation Awareness Week here in Saskatoon. So green is the color of organ donation. We have a number of businesses in Saskatchewan that will be lighting up their buildings and landmarks green on National Green Light Day, Wednesday, April the 25th. In Saskatoon, participants include the Saskatchewan Transplant Program and the City of Saskatoon, which will be lighting up green the Prairie Wind sculpture at River Landing. In Regina, participants include City Square and the T.C. Douglas Building. Last but not least, I would like to welcome the individuals who are addressing us today. Minister of Health, Jim Ryder, Saskatchewan Health Authority CEO, Scott Livingstone, Dr. Joanne Kotchuk, our Saskatchewan's first donor physician, husband and wife, Chris and Erin Willenberg. Chris is a living donor who donated one of his kidneys to Erin. And last but not least, heart transplant recipient, Terry Schrader, and his wife, Selena. Welcome to each of you, and thank you for your support. So now it's my pleasure to introduce the Minister of Health, Jim Ryder.
Thank you, Lori. Honored guests, ladies and gentlemen, it's my privilege to be here this morning on behalf of Premier Scott Moe and the Government of Saskatchewan. Every once in a while, something happens that helps us separate what's really important in life from everything else that's going on around us. The past few weeks have been incredibly difficult. The Humboldt Broncos tragedy has the entire province still grieving. Through that tragedy, we have seen communities across the province come together. The action taken by our first responders, by STARS, and by the staff at RUH has been nothing short of outstanding, and for that, we're greatly appreciative. Amidst all of this, another act of heroism stands out. One young man's decision to become an organ donor provided the gift of life for 6 others. And with us today are people whose lives have been forever changed by organ and tissue donation. Our hope is to build on that gift given by their donors and inspire others to talk to their families so that they can do the same. The awareness campaign that's beginning today will tell their stories and raise awareness about the importance of organ and tissue donation. Our government is committed to improving organ and tissue donation rates for Saskatchewan people. I'm pleased to announce that 3 donor physicians have been recruited to share a half-time position as part of a new leadership model for our organ and tissue donation system. Together with increased public awareness, their leadership will provide the foundation for our efforts moving forward. To the donors and recipients that are with us today, thank you for sharing your story. Together we can save lives. Thank you very much.
Thank you, Minister Ryder. We're appreciative of the continued support from your government. And now it's my pleasure to call upon the Saskatchewan Health Authority CEO, Scott Livingstone.
Thank you, Lori. Before I start, I just want to acknowledge that we are gathering here on Treaty 6 territory and homeland of the Métis. Recognizing this history is important to the SHA as we work towards eliminating and closing the gap between health outcomes for Indigenous and non-Indigenous residents of our province. We all recognize the spotlight that was shone on organ and tissue donation following the tragic accident of the Humboldt Broncos on April 6th. Everyone in the Saskatchewan Health Authority continues to care for those families of the Humboldt Broncos as well as the communities that have been affected by this tragedy. I am proud that our health system responded so well to this challenge, and I am especially proud of the dedicated and compassionate healthcare employees of the Saskatchewan Health Authority, as well as our partners throughout Saskatchewan that helped us respond to this tragedy. In Saskatchewan, helping others is part of the fabric of our communities, and it's gratifying to see the renewed interest in organ donation being shown for individuals across this province. On behalf of staff and physicians involved in supporting donors and coordinating transplants, I'd like to thank those Saskatchewan citizens who have reached out to the Saskatchewan Transplant Program over the last few weeks to inquire about organ and tissue donation. Today, we are launching a public awareness campaign as part of National Organ and Tissue Donation Awareness Week. This is an annual event that shines the light on the life-saving gift that is organ transplant. I urge everyone who wants to be a donor to talk to their family about their decision to donate. Ensuring your loved ones support your organ and tissue donation wishes is very important, given that it is those folks that will likely have to make that decision on your behalf. So making them aware of your wishes is critically important. As you consider being an organ donor or a tissue donor, it's important to also understand that one individual could have a positive impact, a life-saving impact on 8 other individuals, and a single donation of tissue from an individual could improve the life of 75 people in our province. This is truly the greatest gift that we could give. The Saskatchewan Health Authority's mandate is to improve access to timely, high-quality services across our province, and we started that journey a few months ago. Today, the donor physicians that have been recruited, along with the RN donor coordinators, will play an instrumental role in improving organ donation and tissue donation across our province. As we keep patients and families at the center of everything we do, I'm confident we stay on task to improve and transform healthcare here in the province of Saskatchewan. Thank you.
Thank you, Scott. I'd now like to invite Dr. Joanne Kotchuk to the podium. Dr. Kotchuk is one of our Saskatchewan's first donor physicians, so welcome.
Thank you, Lori, for the introduction. I have been given the opportunity to be Saskatchewan's Medical Director for Donation Physicians, and I will be joined by 3 of my ICU colleagues as the first donation specialists. As donor physicians, we are tasked to ensure that potential tissue and organ donors are given the opportunity to donate, and that we will work to try and identify the solutions to the barriers in our province's healthcare system. The national average in Canada for the rate of organ donation for deceased donors is over 20 per million population. In 2017, our rates here in Saskatchewan were only 14. I think it is reasonable to assume that we are not adequately fulfilling the wishes at the end of life for people for donation here in our province. I know we can do better, and that's why I am thrilled to be a part of the evolution of the donation and transplant system we are creating in Saskatchewan. The role of the donor physician is to be the guide at the intersection at the end of life care, death, and donation. To borrow from a colleague, the donor doctor enables families to make the best decision on the worst day of their life. Initially here in Saskatoon and eventually in Saskatchewan, we'll be advising on the care of potential donors, embarking on education and training, and participating in the processes that meet the national standards for donation. As an intensivist, I have seen firsthand the grieving and heartache that accompanies tragedy, and I have also seen the comfort that many families experienced when their loved one is able to donate. I think I speak on behalf of my colleagues who've been working towards a culture of donation in our province over many years, and we are truly honored to be in a position to help Saskatchewan continue to move donation forward. It's because of donors and their families and their stories that compel us to take this step, and it's my undeniable personal motivation. We're so grateful for your bravery and kindness. But it's important to remember that donor physicians and nurse coordinators alone will not be able to raise organ and tissue donation here in Saskatchewan. We need the support of many. We need everyone to recognize and understand the impact of organ and tissue donation and break down the barriers. We need people in this province to talk to their community, to their government, their healthcare providers, and as you've heard already, most importantly, to your family. They need to know your wishes about organ and tissue donation. In a few minutes, you'll be hearing the powerful stories of transplant recipients whose lives have been changed because of organ donation. And on this note, I'd like to close by saying thank you to the donors and their families. We are touched by your selfless generosity.
Thank you, Dr. Kotchuk. We look forward to working with you and your colleagues. As Dr. Kotchuk mentioned, we now have the opportunity to hear from husband and wife, Chris and Erin Willenberg. Chris discovered he was Erin's perfect match in love and in life after learning that she needed a kidney transplant. So please help me in welcoming Chris and Erin to the podium.
Good morning. I waited for a kidney transplant for 5 years. For those 5 years, every time the phone rang, I'd think, is this it? Is this my call? Especially when it was unknown name, unknown number. This could be my chance. This could be my kidney donor. I kept waiting with my fingers crossed, but the opportunity never arose. I was born with an abnormality that eventually led to renal failure, and dialysis treatments started in my mid-20s. I tried to keep a positive attitude about dialysis treatments, and even told my boyfriend that dialysis, it's really not that big of a deal, and I mean, the treatments keep me alive, so we're not going to complain about that.
But the reality, I guess, is a little bit different. Dialysis is a good treatment, but shortly after I met Erin, about 4 months in, she developed a fairly severe infection, which is common with the treatment, and that's where I stepped in and thought, I can't watch this happen without potentially doing something about it. The problem is I don't like blood and I don't like hospitals. So what do? And I did research, and actually I watched many of the videos multiple times that the health region had online about donation. I decided to get tested, and shockingly, test after test after test came back a near perfect match, and finally I was at the point where I thought, boy, I'm gonna have to do this. And I had the opportunity, and I can honestly share with you that it was the best thing I've ever done in my life. And I just want to show you, this is a wedding ring. So we were not married before this happened. And for most people, a wedding ring is simply something you put on your finger every single morning and not think about it. But for me, it's a constant reminder of the ability and the power that organ donation has to change somebody's life. And I'm so thankful that I had the opportunity in Saskatchewan and the possibility in Saskatoon to be able to help my now wife, and we look forward to an entire life together because of it.
I received my transplant in February of 2016, and it forever changed my life. Our families were there by our side, holding our hands and reporting to me on how Chris was doing. Our transplant took place in February of 2016, and our story was taken up by the international media, proclaiming Chris the world's most romantic man. And I can say that I truly agree. We're both feeling great, and it's so nice to move on to the next stage of our life without dialysis. It's amazing to be part of this campaign and raise awareness for organ and tissue donation, and we're very thankful to everyone who's supporting this campaign. The donors and their families are the real heroes. I hope everyone will consider organ donation and make their wishes known to their families. Tonight at supper, you can talk about this story, or you can watch this video later and talk about what it meant to you and what your wish would truly be. Thank you.
Thanks so much, Erin and Chris, for sharing. And as you've heard, they were kind enough to help with a short video creation. So this is going to be the story of Chris and Erin.
3 or 4 months after we started dating, she got an infection that can happen when you're on dialysis. When I saw her get sick, that was when I started thinking, well, maybe I can do something about it.
My dad wanting to donate me a kidney and that not working out, it was hard to believe that it would actually truly happen.
But the blood test came back that we were a match. In fact, we had the same blood type, and I just kept thinking at every chance, you know, that this could actually happen, and in actuality, every single test that came back, we were either a perfect or a near perfect match.
At first, I didn't know what to think because I had lots of people step forward to be a kidney donor, and for one reason or another, it ended up not working out. When the actual, day of the surgery came and we were both in the hospital, it was a pretty overwhelming and emotional time that this was really, truly going to happen.
When you love someone and you see that they're sick and they need your help, I think anyone would do what I did. I think we have an obligation as humans to help each other, and so it was not hard at all to make that decision, at all. If I didn't have her for the last 60 years of my life, how could I ever have looked back and think I made the right decision? Most people don't realize that 137 people die every single year on the transplant wait list in Canada. So it's the equivalent of plane going down every single year for 100 preventable causes. Talk to your doctors, talk to your family. Why wouldn't you? If you can, why wouldn't you help somebody?
Thanks so much for sharing your story. Did you know that about 40 to 50% of kidney transplants in Saskatchewan are made possible through living donation? Our final speakers today are Terry and Selena Schrader. Terry is a heart transplant recipient who had more time with his family because of the gift of organ donation. So please help me in welcoming Terry and Selena.
Thank you very much. Late October 2001, not only did my life change, but so did my entire family. I was not one of those people that constantly runs to the doctor, but after a couple of weeks of not feeling well and a little coaxing from my wife, I went to the doctor. He sent me for an x-ray. The results were my heart was enlarged. That night, I went to St. Paul's ER. After further testing, Selena and I were informed that I would need a heart transplant. That was the start of a 12-year whirlwind for all of us. I was first assessed in Edmonton in 2002. It was decided, yes, at some point I would need a heart transplant, but I just wasn't sick enough yet. I was sent home, my medications were tweaked. I joined the CART program at the field house and did everything I could to stay as healthy as I could for as long as I could. Fast forward 2011. We went on a family vacation to Vegas. First day there, my son David and I decided to race up a flight of stairs. Halfway up, I stopped. I couldn't go any farther. I was coughing and short of breath. I could no longer pretend that things were okay. That was the longest week for all of us. The day after returning home, I saw the team at the Heart Function Clinic. That ended up being my last day of work for several years. Shortly after, I was again seen in Edmonton. they would continue to follow me more closely. June 2012, Selena and I went to Edmonton. I was to undergo 3 days of testing to be put on the transplant list. Instead, within an hour, I was admitted to hospital, and that's where I remained for 3 weeks. During those 3 weeks, Selena and I celebrated our 25th wedding anniversary. My hospital room was not where we were expecting to celebrate our 25th. August 2012, I was put on the transplant list. Now it was real. I had been scared for 11 years. Now I started thinking of things that I might miss. My children's wedding, holding my grandson. I just lived day to day hoping that I'd get the call. February 1st, 2013, I got the call that they had a heart for me. 2 hours later, we were in the air and on our way to Edmonton. February 2nd, 6 a.m., I was in the OR receiving the best gift anyone could receive. Valentine's Day, I was discharged, and 2 months later, we were able to return to Saskatoon. August 17th, Selena and I renewed our wedding vows. I married her with my old heart, then I married her with my new one. Since my transplant, I've been able to see some of my hopes and dreams come true. 2014, I walked my daughter down the aisle. 2017, I held my grandson. This year, I will see my son graduate from the U of S. I've also accomplished things I never thought I could do. I participated in several 5K runs. I have participated in the 2016 Canadian Transplant Games, winning 2 golds, a silver, and a bronze medal. At the Games, I met several remarkable people, recipients as well as donor families, from young to old. We can now even plan for our future. I would like to thank the doctors, nurses, friends, and all my family for all their help and support through this journey. I could not have gone through this without them. More importantly, I would like to thank my donor and my donor's family for giving me second lease on life. There's not a day goes by that I do not think of them. Now let's all spread the word that putting the sticker on your health card and talking to your family about organ and tissue donation is the right thing to do. Thank you.
February 1st, 2013, we received a call on behalf of total strangers that would change our families' lives. Those total strangers going through the most horrible time of their lives were offering us a gift, the gift of my husband's life. At some point, they had had a discussion with their loved one and had let their wishes be known. If they no longer needed their organs, they wanted to donate them to someone who did. These total strangers are my heroes. My heart breaks for their loss, and I am inspired by their great generosity. We can never thank them enough for their gift, and not a day goes by that they are not in our thoughts. In 2001, our children were 11 and 17 when we had to tell them that a virus had damaged their dad's heart and that at some point he would need a heart transplant. We have always been a close family and have only become closer through this journey. Our daughter Melissa wanted to say, "What was the longest and scariest time of my life almost turned out to be the most amazing." I am blessed to have such an incredible family, but I am also blessed that there are people in the world like the family of my father's donor. As hard as that night and the years leading up to it had been for our family, it must have been 1,000 times tougher for this other family. It is through their love and generosity, in which must have been their darkest hours, that my family got a second chance to thrive. It is because of them my son will get to grow up knowing his grandfather and make memories with him. And he will know that there are truly selfless people in this world. Words cannot even begin to thank them enough for the life they have given back to us. Our son David said, "The scariest day of my life was waiting for my dad's surgery to finish. This was also the most exciting day of my life. After years of waiting for this moment, it finally happened, a new heart." I will forever be grateful to the donor and their family. Words cannot express how positive you have made our families' lives. Thank you for the most amazing gift you can give somebody, a second chance at life. Many people die waiting for an organ transplant, and we have met several of these people through our journeys. But we have also met more people that are alive because they also received a gift. The 30-plus hours Terry was in surgery and intubated in ICU were the longest hours of my life. As soon as Terry was extubated, he was trying to tell me something. I bent down to try and hear him better, and he kissed me, undoubtedly the best kiss that I've ever received. We all need to remember to live each day to the fullest. We all need to have just that discussion with our loved ones and let them know if we no longer need our organs, then we would like to donate them to someone who needs them, someone like a total stranger. Thank you.
Thank you, Terry and Selena, for your sharing your story as well. And they've also been kind enough to provide us a video that we can share towards our awareness campaign.
I just didn't know how this could happen. And what they don't really know either how it happened. They just assumed that I picked up a virus and it attacked my heart. The doctor did an x-ray and he came back with the x-ray and he showed me that my heart was twice the size of a normal heart. I was in the hospital for 11 days at St. Paul's and they did all their tests, and then the day they came in and said, "You're gonna need a heart transplant." It completely changed our lives. The kids were scared, like you never knew from day to day what would happen. I was waiting just to get sicker, and the thought's always in the back of your mind, like, am I going to die before I can get a heart transplant? But my attitude was, I'm gonna fight. I'm not just gonna give up. Like, I'm gonna do my best because I have a family. It felt great to wake up and know that you have a new heart and that your life can go on and that you can walk your daughter down the aisle and you can hold your grandkids and that there's more life ahead to live.
He's my Tin Man. Terry has always loved The Wizard of Oz. It's always been one of his favorite movies. And just like the Tin Man, Terry got a new heart. Saskatchewan is a very giving province. I think it's a misconception that people have that when you need something, like there's a bank of them sitting there, that they'll just take one out. It doesn't cost anything to give your organs when you don't need them anymore. You don't need your organs when you're gone. In fact, you usually say that God doesn't need your organs in heaven, but we sure need them down here.
It's important for us to remember that organ and tissue donation isn't just about death. As our brave guests have shared with us, it's about life and the potential we have to save or improve other people's lives. So before leaving today, I'll encourage you to take one of the posters located near the door, because each poster showcases this year's campaign participants. You've heard from Chris and Aaron, Terry and Selena today, but on Saskatchewan.ca you can also hear from Donovan, who is a lung transplant recipient. But I will encourage you to pause at some point this week and consider whether you would want to support organ and tissue donation. And then tell your family about this decision. It is a decision that could save lives. We appreciate the time you've taken today and thank again all our guests. Thank you very much and have a good day.